to build a treatment plan or a roadmap, if you would, for that individual patient. So how can the data collected through remote therapeutic monitoring be used efficiently and effectively to drive change by both healthcare providers, payers, and even patients? Well, I'm a big fan. The nerdy part of me, the former academic, really would love to see the data from remote therapeutic monitoring, specifically in the field of like physical rehabilitation, be used as a way to quantify, measure, and predict a patient's um, clinical outcomes over the course of care. So we hear about it all the time through the literature and through the just clinical anecdotal evidence in the clinic that, okay, people that follow their home program will end up better, right? They'll get better quicker. They'll spend less time in therapy. Whatever the outcome is, they'll have less pain. But it would be really, really good to be able to put a fine point on some of that information, not just say, oh, people that complete their exercises get, 50% better than their peers or whatever. It would be nice to be able to say something like, listen, we pulled the data on the last, 1,500 patients that we've seen or whatever it happens to be. And we can tell you that patients that logged into the system and did, whatever, 10, 15% of their exercises, 30% of the time, 30% of the week or something like that, ended up with this kind of outcome versus patients that logged in 5 days a week and did 75% of their exercises or something like that. What it does, what the data that we can get from remote therapeutic monitoring does, really can not democratize, but it can increase the amount of available data that can be used then to drive standard operating procedures, clinical protocols, operational guidelines, all of those types of things. And instead of it being one of those general, well, we've done some studies and these are the outcomes, it gives it more specificity around those recommendations. And no longer is it, well, you need to do your exercises. It's, okay, we know given your diagnosis and what you've got going on that most patients in your situation who complete their home exercises, as an example, 4 times a week, and they do 4 exercises at 30 reps each time or something like that, end up getting better in 6 weeks or something like that. And that's a much more compelling narrative to a patient than you just need to do your exercises. And then on the part of like the payers, even I'm thinking workman's comp or something of that nature, some kind of managed care where there's a vested interest in getting the patient better and back to their primary or their prior level of function as quickly as possible, having that data to, again, build the framework around, okay, based off of the diagnosis and the mechanism of injury and the comorbidities, this is what we would expect to happen after 3, 4, 6 weeks of therapy or interventions. And then using that as a way not only to benchmark clinicians and clinical organizations for their outcomes, but then also to build a treatment plan or a roadmap, if you would, for that individual patient. So those are just a couple ways that I see remote therapeutic monitoring data being effective, both for providers, payers, and then even communicating the importance of completing or adhering to home programs to patients.